The University of Tennessee Medical Center is our region's only academic medical center. Our mission is to serve through healing, education, and discovery. Our goal is to share the knowledge of our physicians and staff in these health education videos as you make healthcare decisions for yourself and your family.
An osteoporotic hip fracture is typically one that's in an elderly patient that has osteoporosis or thinning of the bones. Typically, this happens at the femoral neck, and I'll try to show you here on this model. It can also happen at the intertrochanteric area. The femoral neck is right here, okay? The intertrochanteric area is right here between these two bony prominences. Typically, the elderly patient with thin bone or osteoporosis gets a fracture at this location. That's different than the young patient that has a significant trauma. They can obtain fractures in the shaft or the acetabulum or the cup, but typically the osteoporotic fracture is in this area. And it typically happens due to a low energy fall. The treatment of these osteoporotic hip fractures is really important, and the reason is before we knew what we know today, the death rate in these hip fractures in older patients was near 50%. And why was that? Well, patients are older, they're oftentimes sick, and sometimes these fractures were not fixed or there was a significant delay in fixing them. And when that happened, patients lied in bed. They developed complications such as pneumonia, bed sores, urinary tract infections, and they became weak. So we know now that the sooner that we can fix these and the better we optimize the patient medically before the surgery, the better the results. And we've significantly cut down the mortality rate with this approach. There's various types of surgeries that can be performed. One of the simplest is a open reduction internal fixation with 3 screws. This can usually be done with a minimal incision and a minimal approach. Other ways include intramedullary rodding, sliding hip screw, and if the fracture is not likely to heal, we can just cut it out and replace it with metal, and that's called a hip hemiarthroplasty. The decision on which method to use is highly dependent on the patient, the health of the patient, their age, the type of fracture, and the location of the fracture. And all these factors come into play when we're trying to pick the best way to fix this fracture. I think a patient with a hip fracture would choose UT Medical Center because we've designed a hip fracture pathway. And what this involves is a multidisciplinary approach with lots of team members, including the medical doctor, the orthopedic surgeon, and the physical therapist. Because we know the timing is so important in these fractures and the mortality rate is decreased when we get to these fractures quicker, we try to identify the patients as soon as they come into the ER and get them medically optimized as soon as possible. This allows us to do surgery within this 48-hour window and achieve better results.
We hope you'll join us soon for another medical moment. Visit utmedicalcenter.org or call the Healthcare Coordination Office at 865-305-6970 to learn about services available at the University of Tennessee Medical Center.